Hi, welcome to HealthBeat. I'm one of your hosts, Dr. Christopher Bennett from Orient Family Spinal Center. And joining me today is our other host, Dr. Barry Hobbs from Hobbs Pacific Chiropractic based out of Livonia, Michigan. So today what we want to do in this first episode of HealthBeat is we really want to talk about what health is, where it comes from, what does it mean to be healthy, and how that plays in the role of how the body's supposed to function and how it's supposed to function appropriately. So Dr. Hobbs, when we talk about health, what do you get from your patients and from the people that are out there in the community when when you ask them, what does it mean to be healthy? How do you know if you're healthy? What do you typically hear from them?
Yeah, great question. So typically whenever the patients come into the office and they're trying to regain their health, typically they are trying to get rid of or eliminate a symptom that they're having or a condition, whether it's a headache, whether it's a back pain, whether it's a diabetes. And what they usually find out through the procedures and us educating them on what true health is that it's actually about how they're functioning, not the problem or symptom or condition or disease that they came in with. So typically they will find out that health is actually functioning better, not just feeling better.
Right. Good point, because sometimes the how we feel can really be kind of tricky and a little bit deceiving, because you tend to think that if you feel crummy that you're unhealthy, but yet if you feel great you're automatically healthy. But and I'll talk a little bit about my story later on in the program. But what you tend to find out is that it's possible to have things like stage 4 cancer and not even know it.
Absolutely.
Not have a single symptom from it. It's also possible to feel terrible and actually be healthy. Like when you look at things like a fever, a fever is a normal response of the body. As bacteria invades the body raises the temperature up to try to kill off some of those bacteria, because some bacteria is heat sensitive. All right, and so you really go back to looking at how are we functioning, not really how are we feeling. And so then you look at it from, well, what is controlling the function of the body? What is that mechanism that controls everything?
Yes. One of the great things that we do whenever we do our health talks, and we ask the public and the participants in our health talk is, what's the most important part of the body? And typically whenever we talk to the grade schoolers, junior hires, they may say the stomach, they may say the heart. Typically when we talk to the senior citizens, they may say some other organs or devices that are controlling the body. And the common answer typically is the brain. Right. But as we know, it's actually not the brain. That's not the first thing that's formed whenever we're conceived. It's actually the neural tube, which then becomes the stem of the brain stem, or medulla oblongata. And that is actually what the anatomists call the reptilian brain, which controls and coordinates all bodily functions, all autonomic nervous control systems such as the heart, the eyes, the lungs, the spleen, the digestive tract. And you and I don't have to think about having those things under control. They're on automatic or autonomic control.
Right, and so when you look at what is it that controls everything? So you talked about that brainstem, and that brainstem, basically what it does is it comes out of the base of the head, and it goes through these top 2 bones of the neck called the upper cervical spine, or C1 and C2. And the brain needs to be able to communicate with the body at 100%. In other words, it's telling the body, telling the lungs when to beat, lungs when to beat. Yeah, let's try that again. Heart when to beat, lungs when to breathe, and basically every function of the body is being controlled by that brain. And it uses your spinal cord and all these different nerves that come off of here, and there's about 78 trillion of them, and they run to every single organ, cell, and tissue of the body. And that signal needs to be able to go through there at 100% with no interruption. But sometimes, as you well know, what can happen is that these top 2 bones right here, through a slip, fall, accident, trauma, it could be anything. It could be something that we do every day, like just the repeated traumas that we do to our body every day, like being on the phone like this and texting and all these other things. And these can shift out of position, and when they do, they can actually start interfering with that communication between the brain and the rest of the body. And what that does is it starts the body on a pathway of dysfunction. Right? It causes, yes. And so most people think of, when they think of disease, they think of, I'm sick or I'm not sick, but really a disease is really a process. So things like cancer, things like diabetes, they don't happen over time. They don't happen instantly, they happen over time. It's a progression. And it's about which way are we going in. And so we know that science tells us that that brain needs to be able to communicate with everything in order for the body to function and heal appropriately and adapt like it's supposed to.
Absolutely. Yeah, speaking of adaptation, most of the times when this first interference of these signals from the brain and body, this brainstem occurs, is actually during the birthing process or when we first learn to hold our head up or start to crawl. And what's interesting is that brainstem is protected by that top bone, that upper cervical bone called the atlas, and it's hard. The second bone, the axis, is hard as well, and the skull that sits on top of it is. But the other 5 vertebrae in the cervical spine, bones in the neck, are cartilaginous. They're soft, and they're actually not formed into hard bone until, for girls, until they're about 5 or 6 years old, and for boys, whenever they're 6 or 7. And what that is that's the body learning to form and adapt the weight of the skull on top of that upper cervical spine to the rest of the spine. And like you were saying, whenever those signals get interfered with, typically it's from these jolts, these bumps and bruises. And whenever we later on in life have a disease or a condition, typically they are symptoms that are listed. I have frequent urination. I have pain in my side. And what typically society will do is list those symptoms and put a name or a label on it, such as a disease or condition. And we're here to teach you and educate you. It's more about how you're functioning, not what labels you have.
Right, I agree. So, so we know that when that upper cervical spine misaligns, it can cause all kinds of issues, and it can lead to whole body dysfunction. That can lead to everything. And what's really interesting, you talk about the body adapting. What's amazing is that your head sits on top of these 2 bones that are up here. So if those bones shift out of position, your head goes with it. It does this or does this, and when that happens, you don't walk around really well with your head tilted off like that. So your body will actually accommodate for that by shifting everything else out of position, dropping a shoulder, raising a hip, moving the rest of your spine out of position, trying to get your head, brain, and ears and eyes and everything else level with the horizon. And when that does that over a period of time, the disc, the bones, everything starts taking abnormal pressure. So it's kind of like having the car that's out of alignment, right?
Yes.
So if that car becomes out of alignment, those tires are going to wear out early. They're not going to last 25,000 or 65,000 miles that you paid for. They're going to last a lot less than that. The problem with your spine and your nervous system is that can't be replaced. And so when we get back, we're going to actually take a break. When we get back, we're going to actually go into, I want to learn a little bit more about you and how you got interested in this work. And we'll later on hear my story and how I got interested in doing this. But for now, we're going to go ahead and break, and we'll be right back with you in just a moment. Hi, welcome back to HealthBeat. I'm Dr. Christopher Bennett with Orient Family Spinal Center. Again, with me is Dr. Barry Hobbs from Hobbs Pacific Chiropractic in Livonia, Michigan. And before we broke for the commercials, we were actually discussing, the function of the body and how the brain and central nervous system controls all that, and how that could be interfered with. And this is a very specific type of work that upper cervical specific chiropractic is a very specific kind of work. How did you get involved in this, and what led you to kind of do this as a profession?
Great question. I got involved in it in a very odd way. I used to suffer with headaches and migraines as a teenager, and I got to the point where every time that I was in school, I would have severe neck pain, discomfort that would lead to a migraine by midday. The sounds, the sights, the noises would bother and agitate me, and many times I just wanted to be in a closed, dark, black room. That would then lead to a headache whenever I wasn't in that closed, dark, black, quiet room, and suffered with migraines. So my parents did the typical thing loving parents would do, is take you to the general physician, and classically they would give you a medicine to try to get rid of that symptom and suppress it. That didn't work for me. So then once I went to one physician, I was referred to another physician. Maybe it was a pediatrician, I believe, because we were in a small town in the middle of Illinois. So then went to a pediatrician. They did a little more thorough examinations and still had the headaches and migraines, changed the medications, went for another year, and then I went to a specialist. And they studied my sleep, put all the pads on me, and watched my REM waves, my deep sleep waves, and my cycles to see if there was anything going on with my brain when I was sleeping that was causing me to have headaches and migraines every day in my student life. And never did find anything from the specialist. So then I got sent to the university. And at the university, they would study me and my symptoms for days. And classically, when I was at the doctor, it's similar to like having a car symptom. Whenever you take it into the mechanic, it doesn't act up.
It stops doing it.
It stops doing it, exactly. So many times whenever I was visiting the doctor's offices in the clinics, I wasn't having a headache or a migraine. And I was approximately 16 years old whenever this was occurring, and young and healthy, and nothing that they could pinpoint was causing this. Continued, I loved the study of anatomy and the human body. I grew up on a farm, didn't want to be a vet because I had already studied and dissected all the animals and had gotten into their insides. And the human body and the brain is the one thing in science that we don't know much about, especially the brain and nervous system, which you and I are specialists in. And so I was in biology pre-med, I was in college, and I remember exactly one day I was suffering with a headache, migraine, studying for a final, and I called up my good friend who for the previous 3 years had kept saying, go see my friend, this doctor, and I kept saying, no, no, no. It's vascular, it's neurological, it's not a back or a neck problem. And the guy happened to be a local chiropractor down the street. I was suffering in misery, and I called him up and I said, Keith, what's the guy's name? Now what's interesting, Dr. Bennett, is I went to the doctor's office and I was sitting there, and the doctor was casual and smiling, and there were family and kids in his waiting room jumping around, having fun. It was quite different than all the other facilities that I had been to the previous 4 or 5 years, and I thought, what in the world is going on in this place? What kind of Kool-Aid are they serving here? And what style of cookies? But the most amazing part that happened to me is the doctor had taken x-rays and actually was talking to me instead of my parents and said, Barry Hubbs, you had an accident. You had a severe accident. And I said, no, I haven't. How do you know? He said, your spine is shaped like this, and it's supposed to be like this. Something happened in your life that caused that. Couldn't figure it out. 2 months had went by, and in those 2 months, my headaches and migraines started decreasing in frequency. I went to the guy approximately about twice a week, and no twisting, popping, and cracking, very precise adjustments. Loved the other families and kids and the results that they had gotten. And it was a much different, open, and happier environment than what I was experienced with the specialists and all the private doctors that I had been to previously. And I thought, there's something up with this. Why is what this guy doing affecting my body? He's not giving me a drug, pill, potion, lotion. He's touching my neck and realigning my head and spine naturally, and things are just opening up. But most importantly, my headaches and migraines started to go away. And about 3 months into it, I was getting my head shaved, my hair shaved to look cool for freshman year in college, of course. And I have a scar on the back of my head from an accident that I had when I was 8 years old. And it hit me, aha. Whenever I flipped over those handlebars on that bicycle, hit my head, had stitches, and that impact of that skull onto that pavement jolted my spine, as we had talked about earlier in the show, jolted my spine and created it to twist and turn to take off that pressure of the central nervous system. And it's similar to if a turtle gets flipped over on his or her back, they'll do whatever they can to be upright. And same thing with this junction in our body here at the head-neck intersection, our fuse box, the brainstem of the body. Whenever there's a kink or pressure there, it'll twist and turn to take that pressure off. So my spine had formed into a reverse curve. Well, we know that what that does. That creates abnormal pressure on the disc. I had premature arthritis. My muscles were always tight and stretched. That's why I always had the headaches coming from the neck and shoulders, and then the migraine, where the blood vessels that come in through the top bone and inside the skull, I started getting the migraine symptoms and aura, and the multitude of other symptoms that occur with the migraine: confusion, discomfort, anxiety. And so over time, I would say within 2 or 3 months, my headaches and migraines literally completely went away. I'd say 80%. And I asked the doctor, I said, what is it gonna take for me to be a doctor like you? He said, it's pretty easy. Chiropractic is like pre-med, pre-vet, pre-dent. We're all studying the body. It's all laws of human physics and anatomy. And you are already doing your prerequisites. Apply for your local school. I did and went, and here I am, serving humanity today, doing the natural approach of trying to find that nerve interference and opening it up. And I would love to say, and it is true, that I do not have headaches and migraines anymore because we keep that pressure off of that area that controls the headaches and migraines called the brainstem.
Nice. Nice. Well, I know everyone that I've ever talked to that's done this type of work has always been had some type of story for why they do it and how they got interested in it. And of course, I have a story also, and I'll share that on the next segment. But it's important to understand that upper cervical chiropractic care and chiropractic care is not a treatment for conditions. It's just not. Treatment for conditions is trying to treat an effect rather than trying to treat the cause. So we look at getting that body function, because the cool thing is the body was designed to heal itself.
It was.
Right? If I cut my finger, it heals.
It was.
Now, if I take a cadaver and I cut the cadaver's finger, it doesn't heal, right?
Not at all.
So there's something special within us that animates us, that moves us around, that we call it an innate intelligence, that creates the body on a regular, ongoing basis. And all we do is we just make sure there's no interference in that system.
Absolutely.
And when there's no interference in that system, it's amazing what the body can recover from.
Absolutely.
So we're going to go for a break right now. When we get back, I'm going to tell you a little bit about why I do what I do and why I'm passionate about it. And I think the whole purpose of this show is really to educate people.
Yes.
To have people feel empowered about their health and not feel victim to it. And
Yes.
so we'll be back in just a moment after this commercial break. Thank you for joining us on Health Beat, and we'll be right back. Hi, welcome back to Health Beat. I'm Dr. Christopher Bennett with Orient Family Spinal Center, and joining me today is, as one of my hosts, is Dr. Barry Hobbs from Hobbs Pacific Chiropractic in Livonia. So, by the way, thanks for being on the show, and actually you're going to be a regular on the show, just so everyone knows.
Oh, well, thank you. Thank you. Great. So I gave my story about why I'm here, why we're doing what we're doing, and to teach the individuals about health and that there are answers out there. And I just recently gave my story before the break, and we would love to hear your story, Dr. Bennett, about how you got involved in this work that we're doing.
Okay, so, it really started with me probably back in 2008. In 2008, I was actually doing pretty well. I was going through the rigors of school at the time, and was running on average 3 to 4 miles a day. That's why I talk about, health is not really about how we're feeling. I was running about 3 to 4 miles a day, doing that about 4 to 5 times a week. Felt great. Felt very energetic, full of life. No aches, no pains, none of that stuff. I hardly ever got a cold, hardly ever got a flu. If you would have asked me at the time, I would have told you I'm healthy as a horse. And in about, May of 2008, I was diagnosed with stage 2 cancer. And that kind of, rocked my world a bit, because I had 2 young kids at the time. And when that happened, I started questioning a lot about health and started questioning a lot about what health is, where it comes from. And it was actually not really that one incident, but it was over a time period of several months later that I started really evaluating what it means to be healthy and where health comes from. And I started realizing that the way I was feeling had nothing to do with whether or not I was healthy, because here I was, had a debilitating, a potentially life-threatening disease.
Yeah.
And I felt great.
You were running 3 to 4 miles a day.
I was running 3. I was full energy. Most people tell you, you get really weak, you get really tired. All these other symptoms start coming out, supposedly when you have cancer. And the interesting thing is my blood work even was normal.
Wow.
They tell you, if you got cancer, that certain white blood cells would be elevated. Not mine. Mine were completely normal. So even medical tests sometimes are not accurate. As to, I once had a professor tell me one time that, diseases don't read textbooks. Right. And it's true. They don't read textbooks. So they don't behave the way a textbook says they're going to behave. And so it was this, like I said, following months after my diagnosis, when I was sitting there and a friend of mine actually invited me out to an upper cervical doctor's office to get evaluated. And I really, to be honest, I went kicking and screaming. I really didn't want to go. And he did an evaluation on me. And one of the things that we didn't mention is how we assess that nervous system. How do we know there's an interference there? Because you can't feel it. Most of the time you can't feel it. Only 10% of your nerves in your body are pain-related nerves. The other 90% are controlling all the functions of your body. So you can have no pain and have 90% of your function that's being messed with, right? And affecting your immune system, affecting all these different things. And so I started like really trying to figure out what was going on. And it was my visit with an oncologist and with this upper cervical doctor in Georgia that kind of led me to realize that, I did have interference here. He actually did a reading on me with some specific instrumentation that we use, which is a diagnostic equipment that actually measures how the nervous system is functioning and if there's interference there. And he said, yeah, doc, you definitely have interference at the upper cervical area. And he took some x-rays and found that my C1 was actually shifted off to the right and moved out of position. It was actually interfering with the way the brain was communicating with the body, which, interestingly enough, was changing the way my immune system was functioning. Because here's a really neat thing. I once read that the average human being gets cancer between 10 to 12 times in their lifetime.
Wow.
Between 10 and 12 times. And so you ask, well, how's that possible? And they don't even know it. It's because, when you look at, well, what is cancer? When you look at, remember high school biology? That was a long time ago, right?
Yes.
2 years ago, at least 2 years
Absolutely.
ago. So high school biology, you learn that cells divided through a process called mitosis. And skin cells make new skin cells, and liver cells make new liver cells, and so on and so forth. And but what can happen though is sometimes those cells, when they're dividing, they divide inappropriately or improperly. And when they do, what they call rogue cells, inappropriately functioning cells. And if those rogue cells continue to replicate, they become a tumor, right? And if it's in the liver, it's liver cancer. If it's in the lung, it's lung cancer. But the cool thing is our bodies are set up to fight that. And they have a specialized cell in the immune system called a T killer cell.
Yes.
And what that T killer cell does is it looks for those cancer cells and kills the cancer cells. Well, when your immune system and your nervous system are not functioning properly, it doesn't work the way it's supposed to work. And so pretty soon that can grow unchecked. And that's what had happened with me. And so I was kind of faced with that decision as to what to do. And I didn't know what I know now, and I started going through traditional medical treatments for it. And I realized that, health is about functioning at 100% and having that body work the way it's designed to work. And as a result of that, you're able to actually achieve true health and not just, better feelings. Right, because I also, the other thing I tell patients all the time is I say, well, is it possible to feel crappy and actually, be healthy? And it's, you think about things like food poisoning. One of the worst experiences I've ever had in my life was food poisoning.
Absolutely.
But is that a normal function of the body? What's the body trying to do with all that stuff? It's trying to get rid of it.
Get rid of it.
Get rid of the toxins. And so we have to start looking at the body as, how is it functioning, not, how is it feeling?
Absolutely.
And so the real purpose of this whole show is what we want to do is over time we want to bring on some different people because there's more to health than just nervous system function, right? It's all about what we're eating. It's about how are we moving. It's about all these different things. And so we want to bring on guests throughout this show to really give people valuable information so that people don't wind up like I did and people don't wind up in the situation that you found yourself in. And about having the community be empowered to know that they're not doomed to their genes, that you have a choice in the matter. You have a say in how your health goes, right?
Absolutely.
So I really want to thank you for being here today. And this was a lot of fun. And I'm looking forward to the next episode and subsequent episodes after that because I really feel like this is going to be a lot of good, valuable information for the community. And I want to thank you for what you do for your patients and for your community in Livonia, and just welcome you back next time for our next episode. And thanks for joining us today on Health Beat. And I don't know what else to say after that.
I would say that as we're talking,
yes,
your health is your greatest wealth, and health is mental, physical, spiritual, and chemical well-being, not merely the absence of
sickness
conditions,
and
disease.
Right.
So we are super excited to be here and give you information to empower yourselves to take action to try to regain and then keep your health.
So if you have any questions about anything we went over on the show, feel free to email us at the link below. And again, thanks for being here, and we'll see you on the next episode of Health Beat.